Hello, and welcome to our September episode of County Conversations. On this month's episode, we would like to talk with you about the Centerville Clinics Incorporated, as well as fill you in on some upcoming events in Greene County. To begin today's episode, I would like to introduce a couple of our guests here today. We have Ed Mariotta, who is a board member for Centerville Clinics Incorporated, and we also have a Greene County girl who is a native of Carmichael's, Marianne Gideon. Marianne serves in two capacities. She is a board member, but she's also the advocacy coordinator and does a lot of their social media too, I think, on the side. So at this time, I'd like to introduce them to come up and educate us on all the wonderful things that Centerville Clinic does.
Good morning. My name is Marianne Gideon. I'm a board member and also the advocacy coordinator for Centerville Clinics. To give you a little bit of background, we have 13 medical offices, 5 dental offices, 10 behavioral health offices. We serve 13 school districts, and we also have 2,500 school students. Our patients, the background on that, we have 14% uninsured, 40% are Medicaid, 23% are Medicare, 23% have private insurance. We have annual patient visits over 108,000, and the Affordable Care Act assists 1,767 patients.
I'm Ed Mariotta. I've been a board member at Centerville Clinic since the 1980s. And I think if you want to understand Centerville Clinics, you have to start from when the clinics was founded. Centerville Clinics dates to April of 1955. John Jablonski and a couple of other miners from the United Mine Workers wanted to bring health care to the coal fields. They had 3 goals. Number 1, they wanted to provide health care where there was none. Number 2, they wanted it open to the community. And number 3, they wanted to never turn a person away for their inability to pay. That first operation was in an old farmhouse in Centerville Borough. Today, we have 13 medical facilities, 5 dental, 10 behavioral health care. Last year, we saw about 105,000 patient encounters in all the locations. And one of the things that we take great pride in is the fact that the next time we turn a patient away will be the very first one. It was a revolutionary idea then. It's a revolutionary idea now. But we're here to serve. That's Centerville Clinics.
I can add where we have our locations. Our medical locations are Bentleyville, California, Carmichael's, Charleroi, Connellsville, Donora, Fairchance, Republic, Uniontown, Washington, Waynesburg, and the Jablonski Clinic in Centerville. Also, we have 5 dental offices. There's some overlap in these, but Charleroi, Connellsville, Republic, Washington, and the Jablonski Clinic in Centerville.
I know if you live in southwestern Pennsylvania, you've got lots of space between things, lots of rural highways. And somebody says, well, okay, so I live in, pick a town, you don't happen to have a clinic there. Where do I go? If you call the Jablonski Clinic, they'll make sure you get to the right place. So it's a one telephone number kind of proposition. And the great thing about it being a network is that once you, in essence, tap into it, you're in the network. So, for example, let's suppose that you're in Bentleyville and you need a dentist. Well, we have dentists. And it's not like you're a new patient. You're one of our patients, and then you go see the dentist. You need a pharmacist. There's a pharmacy at the Jablonski Clinic. So it's overall, it's a network operation. The idea is everything we do, we focus on the patient. That's been our operating philosophy since 1955. It is not going to change.
Centerville expanded into 2 new locations in the last few years, Washington City Mission, we have an office there, and Donora. And we also purchased a new facility and remodeled it in Connellsville. We have remodeled our Washington office, and we recently did a $1.9 million renovation at our Carmichael site. Along with Centerville Clinic's medical director, Dr. Daniel Holt, they also established collaborative working relationships with the 5 hospitals in the service area and developed partnerships with several organizations in our region, including the American Heart Association, Washington County Drug and Alcohol Commission partnered with a medically assisted treatment MAT substance abuse program, the Washington City Mission, the PA Medical Society, and the Washington County Food Bank.
And one of the other things we want to touch on is Centerville Clinics has had a long tradition of dealing with behavioral health care. And our approach is, like most places, is we have this continuum of care that at one end is I'm having a bad day and I kick my dog. On the other end is I'm a hazard to my neighbors because I've just gotten my gun out. But what we do is we go into houses, we go into schools, we go into community organizations to meet patients where they need to be met so they get what they need, whether it's partial hospitalization or it's an in-school visit. We have blended case managers and wraparound programs and all those things that are tools to help people, because it's one thing to have good mental health. It's another thing to have good mental health in an area where you're getting stress. Maybe it's school or maybe it's work. And so we try to deal with those people in those settings so that they develop the strategies it takes for good mental health.
In 1977, Centerville Clinics was awarded a federally qualified health center status, which continues with our primary mission to serve the and underinsured and the elderly in Washington, Fayette, and Greene counties. Fayette and Greene counties are two of the poorest and least healthy counties in Pennsylvania. All services are provided regardless of ability to pay, and that is also continuing our long-standing mission of serving the community.
I want to thank Marianne and Ed for coming in today. This is Commissioner McClure, but I want to tell you that just recently I went and toured the newly remodeled Centerville Clinic in Carmichael's, PA, and it is a very modern, beautiful facility. And if you could, Ed, tell us all the services that are provided at the Carmichael's Clinic.
Carmichael's Clinic primarily is a medical office, but we also have a podiatrist on staff. We've got a lab there for testing. We've got a lot of behavioral health care people that work out of the Carmichael's office. Carmichael's Clinic, like all the clinics, we evaluate what the community needs, and then we find the people that meet those needs. It's not a matter of saying, I've got square pegs and I don't care. I'm just going to drive them in the round holes. We want to respond to what people need. We pride ourselves on a couple of things. Number one, the best appointment you can get to see a doctor is the one you get now, not 5 weeks from now. So that they're timely, they're convenient. We don't believe in having people sit in our waiting room. So you're going to get, and if you're like me, you don't like to sit and look at 3-year-old magazines. We don't want you to. We want you to see the doctor. We want you to get the care that you need. And then we want you to be on your way to do whatever it is you're going to do that day. So we really believe in that. We really believe in what our founders started in 1955, and we haven't wavered, not one little bit.
Marianne, could you share with us a little bit about the Black Lung program that Centerville Clinic offers?
Yes. Centerville Clinic also has a Black Lung Clinic, and Dr. Daniel Holt is the medical director there. He is also our medical director for the entire medical clinics. We can see people that worked in the coal mine, worked outside of the coal mine, worked on the barges, and we can also see people who have chronic respiratory disease problems. It's open to the public. Also, they can get their family doctor to get the reports when they're available.
Well, thank you for that information on Centerville Clinics. We certainly appreciate them as an asset in our communities. And now, we'd like to tell you a little bit about some of the fun events coming up in our area this month. The 50s Fest and Car Cruise will be held in downtown Waynesburg on September 9th from 10 a.m. to 4 p.m. The Farm to Fork, Greene County, is happening at Thistlewhite Vineyards on September 9th from 3 to 8 p.m. There will be a stand-up comedy night on September 15th, which also occurs at Thistlewhite Vineyards, and that begins at 7:30 p.m. The White Covered Bridge Festival is coming to Greene County, and it's the weekend of September 16th and 17th, and each day begins at 10 a.m. Mount Morris Volunteer Fire Department Car and Truck Show will be held on September 17th at 4:30 p.m. There will also be an open house at the Lippincott Alpaca Farm on September 23rd. We hope you enjoy as we transition towards fall weather this coming month and get out and enjoy some of the activities in Greene County.
Yeah, and this concludes this month's episode of County Conversations. But in closing, I want to add that, and we don't want to go back there ever again, but during COVID, Centerville Clinics was a big partner with all the medical facilities and pharmacies in Greene County that helped us get through that, knowing where to get shots and anything else you might need during that time. So just want to thank them for being a part of that. As always, we welcome your feedback and suggestions for future topics. Please reach out on social media with input at any time and watch for our October episode on your favorite podcast platform. And thank you for listening.